Hello, my name is Vanessa Garcia. I'll be presenting today about the different positions in order to get C-spine x-rays. Later on, I will be explaining different positions, different factors, everything that you will need in order to place the patient in the right position to get the right x-ray image. I'll be explaining everything about the cervical spine. This position is for an AP C-spine. The patient either has to be supine or standing. When doing this, the patient needs to have the head straight with no rotation in order not to superimpose the C-spine with the chin. Uh, the CR angle has to be centered at the level of C4, and it has to be between 15 to 20 degrees cephalic. The patient should hold the breathing in order to not to have any movement. The shin needs to be extended in order not to superimpose the spine. Some of the factors that would need to be used in this position will be like 75 to 85 kbp. And this a result of the positioning of an APC spine is usually visualized C3 to T4. Here you could see C3 to T1, a little bit of the ribs. The space between the pedicles and the intervertebral disc space are seen. You could see this spinous process is visualized in the middle of the spine in this area right here, there. And the mandible is and the base of the skull is superimposing a little bit of C1 and C2. Here you could see any of the label, the C7, the pedicle, spinous process, the first rib. This is mostly what it needs to be visualized for an APC spine. In this position, the patient needs to be on the lateral. In order to put the C-spine, the patient needs to be on a true lateral. The patient needs to relax and drop the shoulders down in order for the ribs not to superimpose C7. The CR needs to be centered to C4. It has to be perpendicular to IR. The patient needs to extend the shin in order not to superimpose, and it has to bring the shoulders down in order not to superimpose. You have to make sure the patient has to be close to the IR, and this position can be done when either the patient standing or sitting down. This is the result for a cervical lateral view. The chin needs to be a little bit extended right here, so you could see that it doesn't superimpose C1 and C2. The anatomy visualized in this view is the vertebral bodies and the spinous process that you could see it in the back. C1 and T1 needs to be visualized in order to have the properly anatomy that needs to be visualized. For this view, it's called the oblique C-spine. Some of the factors that need to be used on this is the same as the other C-spines, 75 to 85 if it's digital. On this positions, it's mostly preferred to do anterior obliques because of reducing the thyroid dose for the patient. If the patient can be done in the erect position, the mid-sagittal plane, it has to be aligned to the IR in order to have a good oblique position. The head and the body needs to be rotated to a 45-degree oblique position. And the CR angle is 15 degrees caudal, centered to C4 in order to get the oblique position. This is the result of a cervical spine anterior oblique. This position is preferred because it reduces patient dose for the thyroid. In this view, you can see the intervertebral foramina over here that they are level. You can see the spinous process, the inferior or superior articular facets, and the pedicles. And if you're doing an anterior oblique, the side of the C-spine has to be closest to IR. If you're doing a posterior oblique, the side of effect, it has to be farthest from IR. On this view, C2 through C7 needs to be visualized for the intervertebral foramen spaces. They need to be open. These two views are the positioning for hyperflexion or hyperextension. On this, the patient can be unerect in order to have a true lateral. With the shoulders need to be down. For example, this one is the hyperextension. The patient needs to have the head towards the back, the chin raised, and the head tilted as much as possible in order to have the good positioning for hyperextension. This one right here is the hyperflexion. The patient needs to bring down the chin towards the front, and the same as the shoulders need to be bring down in order of free superimposition to have a good hyperflexion. This is the result of a deflection, and this is the result of the extension of the flexion extension views. In this views, C1 through C7 needs to be included. Sometimes when you do C7, it might not be included in some of the patients. And here you could see the spinous process on the hyperextension. They are closed, they're not that open. In order to do this is in order to view the anatomy here, if it's good, if it doesn't have any fractures. And on the flexion, the spinous processes are open, there's separator. And this view is in order to see the back part of the patient. No rotation is when you see the rami, the mandibular, it's not superimposing anything. In this one, though, it's just the spinous process are well separated, and in this one, they're closed and they're together. But the intervertebral bodies, they are a little bit separated and open because of the extension. This position is called the AP, open mouth. In this position, the patient needs to be either on supine or erect position. The arms needs to be by the side. The patient needs to be with their mouth open as wide as possible. The head needs to be aligned so the lower edge of the upper incisors needs to be perpendicular to the film. In this position, you need to have a tube angle and it's perpendicular to the IR. Some of the factors used are 75 to 85 kVp. This is the result of an AP open mouth. The anatomy that needs to be visualized is the dents right here. This is the body. This clear white part here is the upper incisors, and this right here is the lateral masses. That is required to be viewed in order to have a good AP open mouth view. Also, what you could see is the spinous process is right here in this little white clear part, and that's just a result of an AP mouth view. This fracture is called the clay shovelers. It could be caused by any trauma, by the base of the skull, by any car accidents. It usually happens in the spinous process. As you can see here, it caused the C2. The spinous process it breaks into pieces, and this is called the clay shovelers fractures. This is in this view you could do a lateral to better view of the fracture because you could see the spinous process and a lateral view. Thank you for watching my video. I hope you learned a lot of important stuff from my video. Thank you so much.